Today's topic of discussion is going to be on restraining devices. Hi, I'm Kathy Getrust, and I'm an instructor in community health. What are restraints? There are two main kinds of restraints. The first is physical restraint. A physical restraint is defined as any device attached or next to a patient's body that an individual cannot remove easily, which restricts freedom of movement and normal access to the body. That's a mouthful for a definition, but a shorter one is that a restraint is anything that a person cannot get out of on their own. Another type of restraint is chemical. A chemical restraint is any medication given to control a patient's mood or behavior. As a caregiver, you will be more involved in physical restraints, and as a result will be the focus of the rest of this tape. Federal and state laws specifically address the use of restraints in facilities. The Omnibus Budget Reconciliation Act, or more succinctly called OBRA, is a federal law that has brought about changes to the use of restraints in long-term care. The Joint Commission on Accreditation of Healthcare Organizations, also called JCAHO, is another federal organization that guides the use of restraints in hospital settings. These and other laws, such as the Patient's Bill of Rights and public health codes, expect that those of us who care for patients to continually strive to find ways other than the use of restraints to resolve problem behaviors whenever possible. Why are restraints used? Well, there's a number of reasons. One is it's for the prevention of falls, which can result in serious injuries or possible death. Prevention of injury or to self or others is another reason why restraints are used. That can be injury due to aggressive, combative behavior, such as pulling out intravenous, called IV lines, or other tubes. Positioning aids are another reason why restraints are used, to help maintain good alignment and positioning for the patient. This may, for example, help patients to sit upright in a chair without sliding down or slumping over to one side. Important to remember, though, that restraints are never to be used to make an uncooperative patient mind. They are never used for the convenience or benefit of the staff. What are some benefits of using restraints? Well, it may enable a patient to do more for themselves. For example, a bed rail may allow a partially paralyzed patient to turn over on their own. May protect the patient during treatments. For example, a patient may need an antibiotic or other medication given intravenously for a very serious condition. A patient that picks up the IV or pulls out an intravenous line or other tubes may need to be restrained so that they can receive the treatment that they need. It may keep people from injuring themselves due to falling out of bed or out of a chair. However, studies have shown that although the number of falls increased slightly when restraints are not in use, serious injury declined. In many instances, there are more hazards than benefits associated with the use of restraints. Complications of immobility is a big one when the patient is tied down, limiting their ability to move about freely. Some of these complications of immobility are weakened muscles and loss of calcium from the bones that make their bones brittle and easily broken. Another complication of immobility is pressure sores or other skin irritations from being tied down and in the same spot for too long. Also, immobility causes patients to have increased problems with incontinence of urine and stool because the patient cannot get up and go to the bathroom. Constipation is another problem of immobility from limited activity and the patient suppressing their urge to have a bowel movement. Another problem is increased agitation that some patients experience by their resisting the restraint and struggling to get out of them. Depression is another hazard of the use of restraints. Depression from lack of social stimulation and a sense of helplessness being restrained. Reduced social contact is another hazard with restraint use, with less participation in activities and other changes that affect their quality of life. There are also numerous documented cases yearly of deaths that have resulted from restraint use. These deaths usually happen from strangulation, from getting entangled in the straps as the patient slides down in the chair or topple over the bed railing. And you need to understand how it might feel from a patient's perspective to be restrained. Patients describe it in many ways. Some of the comments that we've heard is that it is emotionally demoralizing for them. Some talk about it having a loss of human dignity. Specific comments such as, "I'm treated just like a baby," or "Why am I being punished like this?" or "Can't I be trusted at the age of 85?" all speak to the loss of human dignity that patients perceive when they are in restraints. You can see, therefore, that the decision to use restraints is a very serious one and is not to be taken lightly. There are specific patient policies that need to be in place whenever using restraints. A physician's order must be obtained by the nurse when restraints are to be used. The physician and the registered nurse decide on the type of restraint to be used and the length of time that it will be in place. Always, the least restrictive method of restraint that meets the patient's needs is applied. Only commercially designed restraints may be used. That means it would not be acceptable to roll up a sheet and tie it around an individual while they're sitting in a chair. Continually, we are responsible for looking for ways to find alternatives to the use of restraints. And remember, most of all, that restraints are to be used as a very last resort. Some guidelines if you do need to use restraints. First, always provide an explanation to the patient, even though they may seem to be confused and not able to understand. Check the restraint before use. Don't use it if it's frayed, torn, has missing parts, or is soiled. Apply the restraint properly over the clothing. It is never acceptable to apply a restraint to bare skin. Conceal the restraint as much as possible to preserve the person's dignity and privacy. Check the fit of the restraint. We should be able to slip 2 to 3 fingers between the restraint and the patient. The restraint should never restrict a patient's breathing. Tie restraint straps with slip knots for quick release in the case of an emergency, such as a fire evacuation. Tie the restraint to only the movable part of a bed, never to the side rail or to a stationary part of the bed that would cause the restraint to tighten if the bed is adjusted. Have the call light within easy reach of the patient so that they would be able to summons you at any point in time. Check that patient in restraints every 15 minutes or more often as indicated on the care plan. When you check the patient, you are checking that they have proper circulation of blood to the area that is restrained, that they are in good body alignment, that they are safe, and that they are not hanging over the edge of their bed, hung up in their restraint in some manner, and that their special needs have been met, such as assistance in going to the bathroom. Also, restraints need to be released every 2 hours, at least every 2 hours, for a minimum of 10 minutes. During this time, there is a responsibility for us to check what's called their CMS. CMS stands for circulation to their, the part that's been restrained, to their motion ability, and to the sensation or feeling that they have. Also, change the patient's position. If they've been lying on their back, when you come in and release the restraint, they should be repositioned on one of their sides. Also, provide exercise when the restraint is released. That might mean range of motion or getting the patient up and ambulating them around. Toilet the patient to meet their elimination needs. If the patient is incontinent, be certain to check the incontinence pad to make certain that it is clean, dry, and always remember to cleanse the skin. And finally, provide fluid and food nourishment when the patient is released from their restraints. Things to report to the nurse. Anytime a patient is having difficulty breathing, whenever there might be skin irritation where the restraint has been applied, if there is any disruption of circulation underneath the restraint, be certain to report that. If there is any difficulty moving the restrained limb, and also report any type of tingling or numbness that the patient might report on the area that is being restrained. Community Health Care of Wausau, Wisconsin developed a videotape for their staff demonstrating the use of a variety of products made by the Posey Company. They were kind enough to allow us to use this videotape in our program. The first products that you will see demonstrated show what is available for alternatives to the use of restraints for patient health and safety. The remainder of the videotape will demonstrate the use of various kinds of restraints. Please watch now as these products are demonstrated.
The following 10 products have been purchased from the Posey Company to assist you in providing the least restrictive environment for care. Our goal is to provide for the patient's right to have the least restrictive treatment and conditions, which allow the maximum amount of personal freedom. The first product that will be demonstrated is the Posey Personal Alarm. The Posey Personal Alarm is an aid to alert the caregiver when a patient is moving more than has been determined to be safe. Situations where the Posey Personal Alarm would be appropriate are confused or sedated patients who need to remain in bed, confused or anxious patients who are at risk for falls and have made an attempt to leave their bed or wheelchair, patients who need to remain in a certain position in bed but have resisted staying in that position, such as on their side. The caregiver must listen for the alarm and respond as soon as possible to see what has caused the alarm to sound. The Posey Personal Alarm has 5 alarm settings that can be set to identify patients if there is more than one Posey Personal Alarm in use. Test the unit before application. To test the unit, pull the magnetic bar on the front of the Posey Personal Alarm off the unit. The alarm should sound. If the alarm does not sound, replace the magnetic bar, remove the 9-volt battery from the side battery compartment, and replace with a new battery. Test the alarm. All Posey Personal Alarms are set on the default tone. To select a different tone, depress the tone selector button on the side of the unit. This will give you a 2-second sample of the tone. If you want to hear a longer tone, remove the magnetic bar and then press the tone selector button until you have the desired tone. To apply the Posey Personal Alarm with the patient in bed or a wheelchair, mount the saddle, the L-shaped holder with Velcro on the long side, in a location where the patient cannot easily reach it, and that allows for some movement without activating the alarm. Mount the alarm box on the saddle. Adjust the cord attached to the magnetic bar to the determined length. Attach the alligator clip to the shoulder or clothing where the patient will not be able to remove it. Next, we will demonstrate the application of the Posey Sitter. The Posey Sitter is an aid to alert the caregiver when a patient is attempting to leave their bed. Situations where the Posey Sitter would be appropriate are confused or sedated patients who need to remain in bed, patients who are at risk for a fall through history or physical status, patients requiring mandatory bed rest, or patients that need monitoring of their location for safety or security reasons. The Posey Sitter should never be used as a substitute for monitoring and observation of agitated, combative, suicidal, or high-risk fall patients. The caregiver has a responsibility to listen for the alarm and to respond as soon as possible to see what has caused the alarm to sound. The Posey Sitter uses a pressure sensor pad that is attached to an alarm box that will sound an alarm when the patient moves their weight off the pad. The Posey Sitter can be adjusted to allow the patient to move about in bed and remove their weight from the pad for periods up to 10 seconds. Before installing the unit, test it by turning it on and setting the time delay to 0. The device should alarm immediately. Set the volume to the desired level and set time delay to the desired time. Turn off the unit and hang the control unit on the foot of the bed using the bracket. Connect the sensor extension cable to the pad. Place the sensor pad under the mattress at the level of the patient's buttocks. Connect the sensor cable into the 2-sensor jack on the control unit. Test the alarm again by turning the unit on before placing the patient in bed. Next, we will learn the application of Posey side rail wedges. Posey side rail wedges are an aid to preventing falls and injuries to patients. They can be used to help remind confused patients to not get out of bed without assistance, to close the gap between divided side rails to limit a patient's access to leaving their bed, or to protect patients who are restless or combative from injuring themselves. Posey side rail wedges can be placed on the bed in several configurations. One method is using one wedge to cover the middle gap between the side rails on both sides of the bed. Another method is placing one wedge at the bottom of the bed end side rail to limit access out of the end of the bed. The third configuration is to place 2 wedges on each side of the bed to completely enclose both sides. The fourth option is to place 2 wedges on each side of the bed and one at the head of the bed and foot of the bed for total coverage. Place the rectangular end of the wedge on the bed frame between the mattress and the side rail with the straps facing outward. The wedge is then secured to the side rail using the Velcro straps. Following is a demonstration of the Posey Freedom Splint. The Posey Freedom Splint is designed to be a multiple-use splint for arms, wrists, hands, and knees, and as an arm board. The splint can be used to limit movement and access to medical devices for confused or sedated patients by applying it over the appropriate joint. To apply the device, open the Velcro straps and wrap the device around the elbow, placing the open side on the posterior portion of the elbow. Secure the Velcro straps snugly. Check the patient's circulation frequently. Next, we will demonstrate the application of Posey skin sleeves. Posey skin sleeves are designed to protect IVs or wound sites and to protect fragile skin from tears and abrasions. The sleeve can be constrictive if the limb is large. The patient must be observed for circulatory compromise and skin irritation. Removal and skin inspection must be done frequently. To apply the sleeve, roll the upper arm opening down to the thumb hole. Slip the patient's thumb through the thumb hole and fingers through the finger hole. Roll the sleeve up the arm. The sleeve can be adjusted off the thumb or to a shorter length by doubling the material back on itself. Do not roll the material. It should be flat. Restraint warning. The remaining Posey devices are all considered restraints. The following is a list of warnings and safety considerations that should be reviewed before using any of these devices. Severe emotional, psychological, or physical problems may occur if the patient's movement is restricted. The patient may become restless or agitated if the restricted movement makes them uncomfortable. Consider other alternatives to using a restraint device. Do not attach the straps so that patients can use their teeth to remove or damage them. Devices that are applied too tightly may impair circulation or respirations. Tie straps securely enough so that the patient cannot get the strap over their head. A patient in a supine position who cannot sit up requires constant monitoring. Should the patient vomit, they could aspirate and suffocate. The next product demonstrated will be the Posey limb holder. Remember, the Posey limb holders are restraints. Posey limb holders are designed for those patients who attempt to remove medically necessary equipment or disrupt interventions, such as extubations of endotracheal tubes, nasogastric tubes, intravenous or central lines, and urinary catheters. They are also indicated when the patient presents a harm to themselves or others by their behaviors. Posey limb holders should not be used on dislocated or fractured extremities or when it will compromise an intravenous site. Before using with combative or suicidal patients, the nurse must assess the potential of that patient to break free of the device. They should not be used if the potential exists. To apply the Posey limb holder, open the holder cuff by depressing the release buttons on the sides of the quick-release plastic buckle. Wrap the holder cuff snugly around the wrist so that the connecting straps are on the anterior portion of the wrist. Close the quick-release buckle and pull on the adjustment strap to fit the wrist snugly. Tie the connecting straps to the bed frame. If you want the patient to have some range of motion, you can tie both straps together to a movable part of the bed. To limit the range of motion, tie the straps to separate areas of the bed to create a triangle. To use the Posey limb holders on the lower extremities, apply them to the ankle with the connecting straps on the lateral side of the leg. Always monitor the patient frequently and check for circulatory compromise of the extremity. Next, we will demonstrate the Posey finger control mitts. Remember, the Posey finger control mitts are restrained. Posey finger control mitts are designed for those patients who attempt to remove medically necessary equipment or disrupt interventions, such as extubation of endotracheal tubes, nasogastric tubes, intravenous or central lines, and urinary catheters. They are also indicated when the patient presents a harm to themselves or others by their behaviors. Posey finger control mitts should not be used on dislocated or fractured extremities or over IV sites. To apply the Posey finger control mitts, open the Velcro at the cuff end. Place the patient's hand in the mitt with their palm facing the padding. Close the Velcro snugly around the wrist. If range of motion needs to be controlled also, place a strap through the loops of the mid at the wrist and tie to a movable part of the bed frame. Check for circulatory compromise and skin irritation frequently. Following is a demonstration of the Posey roll belt. Remember, Posey roll belts are restraints. Posey roll belts are designed to allow the patient to roll from side to side in bed while ensuring the safety of a patient who should not ambulate without assistance, has a history of falling, or is at risk to fall if not assisted. Posey roll belts should not be used on patients who have ostomies or gastrostomy tubes, a history of hernias or chronic obstructive pulmonary disease, or abdominal or thoracic incisions. All patients in Posey roll belts must be monitored consistently and have the belt removed if the patient attempts to slide it over their head and chest to prevent accidental strangulation. To apply the Posey roll belt, lay the belt on the bed, soft side up, at the patient's waist level. Tie the short strap to a movable piece of the bed frame. Wrap the long strap around their waist and have them sit up and turn the strap through the slots in the back, and then tie the strap to a movable piece of the bed frame. Check to ensure the belt is not too tight by moving your hand underneath the belt without pressing on the patient's abdomen. Side rails must be used when using the roll belt. Do not use with the bed where the patient can move between the side rails and become suspended by the belt roll. Use side rail wedges to close gaps. Next, we will demonstrate application of the Posey crisscross vest. Posey crisscross vests are restraints. Posey crisscross vests should be used to ensure the safety of a patient who should not ambulate without assistance, has a history of falling, or is at high risk to fall if not assisted. Posey crisscross vests should not be used on patients who have ostomies or gastrostomy tubes, have a history of hernias or COPD, or abdominal or thoracic incisions. All patients in Posey crisscross vests must be monitored consistently and the belt removed if they attempt to slide it over their chest and head to prevent accidental strangulation. Never crisscross the straps behind the patient. This will allow the patient to rotate and loosen the straps to pull the vest over their head or attempt to crawl through the side rails, creating a strangulation hazard. Vests are available in different sizes based on body weight and chest size. Choose the correct size before applying by reading the label and comparing with the sizing chart information on the label. To apply the Posey crisscross vest to a patient sitting in a wheelchair, slide the patient's arm through the armholes with the opening in the front, pulling the left strap through the slot on the right side of the vest to crisscross the vest. Pull the bottom of the vest down to the patient's hips. Make sure the patient's hips are resting against the back of the chair to prevent them from sliding down. Tie the straps under the wheelchair so that the straps come across the hips at a 45-degree angle. Check that the patient is breathing comfortably and you can easily slide a hand between the vest and stomach of the patient. To apply the Posey crisscross vest to a patient in bed, slide the patient's arm through the armholes with the openings in front, pulling the left strap through the slot on the right side of the crisscross vest. Pull the bottom of the vest down to the patient's hips. Tie the strap to a movable part of the bed frame near the middle of the bed. Check that the patient is breathing comfortably, and you can easily slide a hand between the vest and stomach of the patient. Side rails must be up when using a crisscross vest. Do not use with a bed where the patient can move between the side rails and become suspended by the vest. Use side rail wedges to close gaps. Finally, we will demonstrate application of Posey ED security cuffs. Posey ED security cuffs are restraints. Posey ED security cuffs are for extremely violent patients who are a threat to themselves or others. Posey ED security cuffs should not be used on extremities with dislocations or fractures, or open wounds or IV sites. To apply the Posey ED restraint cuffs, wrap the cuff around the wrist or ankle, pushing the tongue of the cuff through the buckle until you can only place one finger between the cuff and patient's skin. Push down on the buckle to lock the cuff. Attach a Posey connecting strap through the metal ring on the cuff and secure it to a movable part of the bed frame. Lock the connecting strap by pushing on the buckle and test by pulling on the buckle. To unlock the buckle, insert the key and turn counterclockwise. This concludes our review of Posey products. Please review this video or the manufacturer's directions prior to usage in the clinical setting.